For the forecast there, today, June 27th, we observe National HIV Testing Day. Despite more prevention and treatment options than ever before, since the pandemic, there has been a steady decline in testing.
In the United States, the average rate of infection is 13 per 100,000. In some cities, it's much higher, including in Houston, where it's 36 per 100,000. To help increase testing, especially in historically underserved communities, CVS Health Action Initiative is working to increase access, I should say. Houston's only TV health reporter, Haley Hernandez, has the story.
Joining us this morning to discuss that, Drexel A. National HIV Liason for CVS Health. Hey, good morning, Drexel. Thanks for joining me.
Good morning, everyone.
So let's be clear, HIV is still an epidemic in this country, and yet there's been a significant drop in testing. Why is that?
So really, due to the COVID-19 pandemic that started back in 2020, there has been a dramatic decrease, in HIV testing. And during that time period, during the stay-at-home orders, if you could remember, many testing in traditional sites, particularly community-based sites, had a lack of HIV testing, as well as in the emergency room, many providers were caring for individuals with COVID, and there was not many HIV tests being conducted. So at that time, there was a dramatic decrease, and we're really trying to change that. And testing is really as more important than ever before because of that dramatic reduction in testing.
So tell us about this initiative and why it's so important for your organization to get involved.
Thank you. So really, to recognize National HIV Testing Day, we've launched a collaboration with Gilead to offer no-cost HIV testing at our participating Minute Clinic CVS locations from June 29th to July 13th. And so this program will allow any individual 18 years or older, really in the Houston metro area, to obtain a HIV test and a follow-up test depending on the result, if it's positive or negative for HIV.
I really love that, Drexel, and we know, of course, that testing is the first step towards knowing your status. So how is your organization helping those who they want to be tested, but they're just too afraid, too intimidated to actually show up and ask for a test and get HIV tested?
Well, I think we're thinking a little bit different than traditional testing sites, and so really to recognize National HIV Testing Day, most community-based organizations will be doing something around HIV testing, either in a parking lot, etc. But particularly with CVS, we're really focusing on reducing the stigma related to HIV testing. And so when someone typically goes to a CVS Minute Clinic Health Hub, they're not thinking about getting tested, particularly for HIV. And so we allow individuals to be tested out at a safe location within our Minute Clinic Health Hubs, and it's not going to be out where a pharmacy, particularly with a pharmacy section, but it's in a private examination room. And so individuals be tested at the privacy and comfort of in a clinic with a Minute Clinic practitioner, as well as they'll be in a place where there's less stigma associated around HIV.
Yeah, nobody knows what happens inside that clinic room. And are there any new preventative measures that we should know about?
Trust me, there's so many, and the biggest one I really want to highlight for everyone, is PrEP, which stands for pre-exposure prophylaxis. And so PrEP has been around for almost 10 years, really. And so PrEP is a medication that individuals can take as a daily pill or as an every other month injection, and actually can reduce the chance of someone acquiring HIV through sexual contact by 99%, and if infected needles, at least by 74%. And so that is a groundbreaking change, that we've never had before. And I'm just happy, the science has really reached a stage where we can prevent HIV at almost by 99%.
Yeah, absolutely. So that's another reason that people can get tested. They don't have to be afraid of the answer because there's a treatment. If the test comes back positive, there's a treatment and people live happy, normal lives. But before we let you go, let's tell people where can they get more information.
And so if you want to find more information about this voucher program, go on www.cvshealth.com/endhivhouston.
All right. Thank you, Drexel A. National HIV Liaison for CVS Health. We thank you for joining us this morning.
Thank you.